One of the most important functions of any fireground scene is size up of the dangers present. As the fire service continues to come to grips with occupational related cancer and other illnesses, one of the most critical elements that we tend to overlook is post-fire contamination of our bunker gear. The following video will show you the most current and best practices as it relates to gross decon and a continuing effort to protect you and your health during your career.
Where there is fire, there is smoke. And where there is smoke, there are carcinogens. Carcinogens that cause cancer and can result in the loss of your career, or worse, your life. Cancer is now the #1 killer of firefighters. Think it can't happen to you? So did many of our brother and sister firefighters who will tell you it's not worth the risk. To reduce our members' risk to carcinogen exposure, post-fire gross decon should be completed at every fire where structural firefighting PPE is worn and exposed to products of combustion. This includes brush fires, vehicle fires, training fires, and any other JFRD incident where a combustion process occurs. At every working fire, gross decon will be established by the engineer of the second arriving engine, unless otherwise assigned by command. The decon area should be located within the warm zone, away from the fire and smoke, but as near the area where crews will be exiting the hot zone as possible. The engineer of the second arriving engine should mark the decon area with a cone so it is easily visible to crews exiting the hot zone. The engineer should retrieve the decon kit from his or her apparatus and begin setting up for gross decon as soon as possible after receiving the instruction from command to proceed into the fire. The decon kit should remain stocked and ready for use at all times. The decon kit should contain 1 2.5-inch to 3/4-inch adapter, 1 green 50-foot 5/8-inch hose, 1 low-pressure garden nozzle, 1 bottle of Dawn detergent, 1 soft bristle brush with handle. A truck brush with a handle may be used. Trash bags, at least enough for your entire crew, and skin wipes. Note, skin wipes may also be provided near or in the rehab area. It is recommended that each apparatus carry additional skin wipes in the decon kit in the event that the department-provided dermal wipes are not available. The engineer will set up for gross decon by completing the following steps. Connect the 2.5-inch to 3/4-inch decon adapter to a discharge outlet. Connect the 50-foot 5/8-inch green decon hose line to the same discharge outlet. Attach the low-pressure decon nozzle to the end of the hose line and charge the hose line. Hook the handle of the nozzle on the top of the cone so that it is readily accessible. Add Dawn soap to the decon bucket and fill with water to make a soap solution. Place the brush in or next to the soap solution so that it is ready for use. Note, a pre-connected booster line and nozzle may be used. However, use caution to only use at idle pressure to avoid embedding contaminants into PPE. It is recommended that the engineer don appropriate PPE prior to performing gross decon. Just as you would not perform decon of medical equipment without the use of gloves or other appropriate PPE, you should also take care to protect yourself from carcinogens which can transfer dermally during the gross decon process. At a minimum, the engineer should don structural pants and boots and EMS gloves prior to performing gross decon. The use of a respirator is also recommended, if available, or, if conditions warrant, an SCBA may be used. In the event the engineer is needed elsewhere for manpower purposes, crews exiting the hot zone can perform gross decon on each other prior to doffing their PPE and equipment. However, it is important that the engineer of the second arriving engine assures that the gross decon station is set up for this purpose prior to committing to another assigned task. The importance of getting the gross decon area set up and established early on in the incident cannot be stressed enough. Crews exiting the hot zone should be able to immediately proceed to gross decon so they can doff their equipment and begin the rehab process. Upon exiting the hot zone, crews should remain on air and proceed directly to the gross decon station. If, when exiting the hot zone, you are low on air or out of air, you may disconnect your regulator, but the facepiece should remain in place. Personnel who are low on air should receive priority during decon. Gross decon should begin by spraying the PPE with water at the neckline and working downward. This process alone will remove 50% of contaminants. Personnel performing decon should use caution not to spray any area above the firefighter's neckline. This will assure water does not permeate the inner liner of the PPE, which can result in steam burns if the firefighter must don their PPE again prior to washing and drying. The soap solution should then be applied to all areas of the PPE, from the neck downward, with the soft bristled brush. The SCBA and straps can also be gross deconned during this process. The soap solution will remove up to 80% of the remaining carcinogens. The PPE should then be sprayed once again with water from the neck downward to rinse all the soap solution. Helmets may be washed with soap solution in the gross decon area, but should be removed from the head prior to cleaning in order to avoid water permeating down the collar of the firefighter's PPE. Only the outer shell of the helmet should be washed. The hood and facepiece should still remain in place during this process. After completing the gross decon process, crews should then proceed to the PPE drop zone, where they will properly doff their PPE and equipment. All PPE should be removed in this area. At no time should any PPE, including pants and boots, be worn into the rehab area. Use care when removing PPE to avoid further dermal contamination to any carcinogens that may remain on the PPE. It is recommended that the particulate hood be removed at the same time as the facepiece during the doffing process. As soon as all PPE is removed, dermal wipes should be used on all exposed areas of skin. This process will remove up to 54% of carcinogens on the skin. Use a clean wipe for each area of skin, one for the face, ears, and neck, and one for the arms. Be sure to wipe both hands thoroughly. If wearing shorts under PPE, wipe each leg as well. Skin wipes may also be used to clean portable radios, helmet liners, and SCBA face pieces at this time if desired. Face masks may be cleaned in a separate bucket on scene if mask wash is available, or may be more thoroughly cleaned upon returning to the station. Once gross decon is completed, the firefighter should proceed immediately to rehab. After completing rehab, crews should await further instructions from command. If a large-scale incident requires crews to be called back into operations, crews may re-don PPE and report for their new assignment as directed. If further exposure occurs, crews will repeat the entire gross decon process. Prior to leaving the incident, crews should don EMS gloves and begin the process of bagging PPE for transport back to the fire station. All PPE should be placed in a garbage bag with the top of the bag tied and/or taped securely. Crews should place the sealed bag inside the cab of the apparatus and use disposition code Delta when leaving the incident scene. If crews receive another high priority call prior to returning to the station, the bag can be ripped open and PPE donned again if needed. Contaminated PPE should be resealed in a bag until it can be washed in an extractor. Again, personnel should consider the use of EMS gloves when handling contaminated PPE or equipment. Remember, get in, get out, get clean. Set up gross decon at every fire. Make it a habit. Protect yourself from carcinogens at all times, even in the warm zone. All smoke contains carcinogens. If it's not clean air, then it's full of carcinogens. Treat it as such. Wear gloves anytime you handle dirty PPE and equipment. If they were covered in blood, you wouldn't handle them without gloves. Carcinogens cause disease also. Treat them the same. Use soap and dermal wipes. Don't skip steps. Every little bit helps. Shower as soon as possible after the fire, preferably within the hour. Clean all equipment thoroughly after every fire. This includes radios, radio straps, and the apparatus cab.
Thank you for watching. As we continue to evolve our policies and procedures, such as second sets of bunker gear, shower within the hour, face wipes, diesel exhaust extractors, only so much can policies and procedures do. Part of it is in your hands in an effort to follow these, such as on-scene gross decon. Thank you for watching.